Good afternoon. So before starting, I'd like to thank the Bioconnect 3.0 team for inviting me. And I also like to congratulate them for the fantastic event. So when I was asked to talk about the AI in healthcare, I remembered what Geoffrey Hinton told when the GPT-4 has been introduced. So we all know about the Geoffrey Hinton. He's regarded as the godfather of deep learning. So he quoted that caterpillars extract nutrients, which are then converted to butterflies. People have extracted billions of nuggets of understandings, and GPT-4 is a humanity butterfly, which is very true when we talk about AI in healthcare. Why? Because if we look at India, it is a warehouse, it is a powerhouse and warehouse of data. And not only data, the diversified data. So this AI in healthcare, what are we going to do? That is, we are going to empower the clinicians in advancing the care. So let me start with the problem statement. So what are the strains on healthcare? The first come the shortage of professionals. So today I was reading, okay. So today morning I was going through an article and I found out the asynchronous ratio between the doctor and the patients. In India, it is one doctor and if you look at the patient's ratio, it is 834, which includes allopathy and Ayush. And if we look at the ratio between the radiologist, it is 1 in 100,000, which is humongous. I belong to Samsung, and we are into the imaging, the radiology equipment. Here I will talk about ultrasound specially, because ultrasound deals with the real-time scanning. I'm not, because of the paucity of the time, I'm not going to touch X-ray, CT or MRI. I will talk about ultrasound specially because the ultrasound gives a distorted image. It is an imaging plane. But when we talk about the other modalities, those are anatomical plane, and the AI works on the post-processing. But in the case of ultrasound, it will be on the real-time imaging. And then about the accessibility. That is accessibility of a large population. The remote consultation is required for professional access to medical service, and then there is a urban and rural gap. So how AI is going to breach that gap? And then the total cost of ownership, because the operational cost is rising day by day. And these costs will get translated to patients, because hospitals or the medical institutions are not going to bear the cost alone. So how AI is going to help in order to minimize these costs? So what modern healthcare needs? Just an overview. It needs a faster workflow, workload support, reduced burnout for the healthcare professionals. Because I was listening to the healthcare professionals since morning, and these things are coming up very essential, interestingly. Another is reproducible results, comprehensive evaluation, and actionable insights. So these are the asks from the AI. So now, the technological advancement could be the answer. Intelligent assisted technologies help healthcare ecosystem, both the clinicians and patients. So this reminds me of the socio-materialism theory, when in the 1970s, the famous philosopher Foucault, the Foucauldian, went to do an X-ray of his broken arm. There, he proposed that human actor and non-human actor. Now AI is going to be a subset or a superset along with the human actor. Let's see. So AI in healthcare, what do you want? Seamless scheduling and reporting, system setup and dose optimization, automated detection and measurements, triage and prioritization, data integration across sites, across modalities. because the interoperability of the data is very, very important. So what Samsung is doing in the medical AI development? We started our AI journey in 2010 when very few people were talking about AI. In 2016, we worked on the static data, enhancing the workflow and diagnosis. In 2020, we worked on the Cine and the volume data, real-time eliminating reliance on user input. And in 2024, we started working on the multimodal data, that is automating final impressions with multimodal AI. So here, we have started working on the enhancement of the imaging, RF-based deep USFF, where the deep learning has been introduced, and automation via multimodal model. So technology after COVID, and particularly AI, is in super fast mode. So the large language models for understanding and reasoning has arrived. The multimodal foundations models for comprehensive and contextual clinical assessment is here now. Conversational assistant for on-the-fly and support, ability to digest and learn more from everywhere and everyone. So here the question lies whether AI is going to replace the doctors, dictate the terms. The answer is no. AI will work hand in hand with the doctors. The simple reason is our body is still a black box. And a doctor, the human actor, can decipher the black box, not the technology alone. It will act as a junior partner to help them. So what are important things which you are going to do with AI? One is image quality and consistency. With the help of AI, we are going to do image tuning, the clinical workflow, the live assist. Because whether the doctor will concentrate on the machine or they will take the patient's care more. So that is the question. So where the AI can help with the assist and the new biomarkers with the deep, means just for an example, to find out a fat fraction with the ultrasound modality. So these are the technological roadmap which we are going to work, or we are working today in order to make both the doctors and patient life easier. So the first, we are transitioning from the hardware beamforming to the software beamforming to increase the fluidity and liquidity of data. Because for a good AI model, we need a good quality data. So this is an example of a live breast assist. That is, I started the presentation stating that it has to be on the live imaging. I'm not sure whether it will work here. So while doing the scan, it will help the doctor to pick up the lesions. So it will help the doctor not to miss any important lesion while doing the scanning. It can be the smallest of the smallest lesion, but it will be attracting to their eyes, and then after freezing the image, they can go for a S-detect. So both are AI. One is while doing the scanning and after freezing the image to do the evaluation. Next is uterine assist, where the doctors can reduce the repetitive jobs from the 10 second to 1 second, which will help the patient, which will help the doctors to do more number of scans. It will increase the throughput. Similarly, in the nerve track, because sometimes it becomes very difficult for a doctor to detect the nerves, the right nerves. So here, the AI will help to detect the nerve amongst the muscles or other tissues. So this is also in the real time. You don't have to freeze the image. Next, the clinical operation efficiency, the auto measurements. So you don't have to do repetitive measurements. The AI will help you to do the auto measurements and will speed up your scanning process. Next, the quantitative measurement of hepatic fat. Because now with the ultrasound, you can do the fat measurement. So it's very easy. Here, just to do a brightness comparison between the liver and kidney, the results will come immediately. Next, the seamless AI to POC reporting. When there is a point of care, the things become much more difficult. So the reporting part, you leave it to AI and it will come up seamlessly. Next, what are the barriers of adoption? So one is, can I trust it? What about data privacy? Is it approved for use and validated? Will it disrupt my usual flow? So one of the most important part of it is the ethics, because whether the data which we are getting from the patients are getting leaked, because we have seen in the recent past, there was a two big data breaches happened, one from the AIIMS Delhi, another from Safdarjung Delhi. So how we are going to limit this, or how we are going to avoid this? There is AIIMS an opportunity, the accuracy of diagnosis, expedite treatments, improve patient outcomes, drive down cost is fine. But the ethical challenges, the privacy of data subjects, the risk of unintended harm to patients, and the fairness to marginalized populations. So this is very important. And these are the principles: the fairness, accountability, transparency, and security. So this is the ethics pathway. I'm not going into the details because these things are known to every one of us, and we have to maintain it. So this is the overall vision of reflects across the offerings. One is reliable, reproducible, and reliable outcomes, ethical, fair and transparent data handling and development practices, democratic, advanced technologies for all. Techno-clinical collaboration is the key, because during the last panel discussions, I was listening when the doctor is telling that what you come up is not acceptable because we are not being discussed. We are not being a part of that innovation. So this is very, very important. So together we focus on identifying unmet needs, transforming data into insights, and ensuring workflow usability. So India is where it all meets: large and diverse population, rural and urban scenarios, zest for innovation and tech adaptability, and expertise across fields. We have all the resources. We have and starting from the expert to the huge amount of data. So we are working with the clinicians because we have to listen to them across the world. And India, we have started. We are going to expand these AI centers in all the states. We have started just last year. And we are looking across India to do a tie-up, to do a collaboration with the experts, with the experts and the KOLs across the country. And this is the eyes on the future, that what are we going to bring to the table with the technology and AI, along with the doctors. That's imperative. So we are looking at the cardiovascular disease, because India is going to become a cardiovascular disease capital. An estimated 70.9 million people died from CVD in 2019, representing 32% of all global deaths. Early detection of cardiovascular disease is important. Ultrasound is a gold standard for screening, diagnosis, and follow-up the heart disease. So these are the statistics and how the cardiovascular disease, the cerebrovascular disease are affecting the population, and how the medical equipments are going to do the diagnosis. So this is a heart assist. Just look at it, that how it is easing out the workflow of a clinician with a 93% fewer keystrokes. And this is a solution which is going to help the patient as well as the doctors, because the doctors will not get strained. Their burnout rate will get reduced. So this is the statistics: less keystrokes and saved exam time up to 88% of less clicks, up to 90% time saved, 98% accuracy and 100% reproducibility. So that's where AI is going to play its role. And also in coming out the real-time auto-ejection fraction. This is a live liver assist. It is also during the live scanning. They will pick up the lesions, and then the characterization of the lesion will be done. So these are all happening while we are doing the scanning in real time. So this is the segment anything in the foundation model, doing the annotation, labeling is a tedious job. So AI will help you to do that and increase your efficiency, increase the outcome of the results. These are upcoming features, auto frame and ROI for the liver. This is for the fibrosity and the liver elastography. This is the auto IVC for fluid responsiveness, where we are not limiting to the structures, but also the flow. We are going to measure the microliter of the flow. This is getting into the lungs, a very challenging area for the ultrasound, and we are trying to explore that with the help of AI. And this is not for the diagnosis, but for the emotional quotient of the mother, a portrait view. This works on generative AI. And then, last but not the least, let's build future with AI together. Thank you.
Thank you, Dr. Das Gupta, for such an insightful and forward-looking keynote. I now invite Shri R. Harikrishnan, IRTS Executive Director, KSIDC, for handing over the memento to Dr. Das Gupta. If audience have any questions, they can ask now.
Thank you for that wonderful presentation. My name is Rohit. I work with the Kerala Medical Technology Consortium. My question is two parts. Number one, India has massive amounts of data to probably train AI tools, but the quality of that data may be question. Would you like me to repeat the question?
Pardon?
Would you like me to repeat the question?
No, no.
That's fine. So India has a lot of data that can be used to train these AI tools, but do you think the quality of this data everywhere is okay? Is it up to the par? That is part one of the question. Number two, if a state government like Kerala or a large group of healthcare institutions wants to enter into helping organizations like you leverage this data, what kind of policies, what kind of guardrails would you suggest so that breaches like the one that happened at AIIMS and Safdarjung don't happen?
So I will come to the second question first, because that is very, very important. Because we have been seeing how we are exploited with the pharma. So that should not get repeated. Because who is the real owner of the data? We have to recognize, we have to accept, and we have to identify. So the real owner has to give in their due, honor or due rights to them. So we have to frame a policy together. It is not only the onus on the organization, but also the government. And you have to find out the right path to utilize, not exploit. So that we have to work together in the policies, in the regulations, and we have to frame the right law for that. So there is an opportunity to explore and work together. And the first question, if you can just give me a pointer. Quality of data. Yeah. So you see, one of the most pertinent problem is there, like the rain shadow area, there are data shadow area, which we are not able to explore. So the uniformity is needed. And that will bring the quality. Because we are getting data from a data-rich area. So that cannot be used for we cannot generalize that. So if we want to do a real AI model, which we can generalize, we have to have an uniformity in data collection. So that's my take on the quality.
Sir, here. Sir, it is a hypothetical question. Sir, it is about AI doctor's dilemma. If an AI doctor's dilemma is that when he performs surgery, the patient likely to die from his millions of petabytes of data, the AI doctor figure out that the patient is going to die. Unlike the human doctor can't predict that. But a doctor from petabytes of data reach the conclusion that the patient is likely to die. It is a sort of trolley ethics. Trolley ethics. So how you resolve that AI doctor dilemma? That is my question.
So the dilemma is not only with the AI, but with the technology. The doctors are here. They can give you much more accurate definition of death, because there has been cases when a patient is taken to an MRI, and you know MRI is a functional imaging. It shows the patient is dead, but in reality the patient is still alive. So that dilemma still exists, because today I think that confusion is there everywhere, that what is death and in which stage you are going to declare the death. So it is not, the data cannot alone solve the problem. That's the reason I told you, even the human body is a black box, and only the humans, the doctors, can decipher it.
I think that without unique digital medical record, how that AI will help that physicians to diagnose with AI, that decision support and all.
Pardon, sir, if you can
Now,
just repeat.
without unique digital medical record, all this AI cannot be implemented. That is that's why the government has to take actions to regularize the medical records, digital medical records, in central places, that's in clusters. Otherwise, it is not possible.
Yeah, very true. So I think the government is working on the EHR, electronic health records. But you know, the worldwide is a big problem. Even the Western European countries, they are yet to reach that stage. They are working on the e-prescriptions as a data. So this is, and for India, it is much more difficult, because it's a huge country. The diversification is there. So we need to hold our horses. I think there are initiatives going on from the government side, where both state and central government are working together to resolve this problem, because that has to be there. It's not only the EHR, but the interoperability of the data is also a big question. So we have to work, means we have to build an ecosystem for that. Thank you.